Hello, my name is Brianna Gregory, and today we will explore key ethical considerations and communication strategies dealing with diverse populations in healthcare. Cultural understanding in healthcare is a vital part of caring for the patient and making sure that efficient, well rounded care is being delivered at all times. The other important thing to remember is to engage with the patient regarding whether or not the topic is understood or if they need any further aids to assist them in understanding the explanation further. During this video, we will briefly look at some history regarding research and ethical concerns, as well as some tools for healthcare professionals to aid their staff and patients in understanding barriers related to cultural competency. Scientific communication is grounded in clarity, accuracy, brevity, and objectivity, which are principles to ensure that information is accessible and understandable by all, regardless of cultural background. Diving into ethical implications dealing with human research, especially within diverse communities, ethical considerations extend beyond standard protocols to also include cultural understanding and respect. Informed consent must be understood and given to the patient in a manner that is culturally appropriate, ensuring comprehension by the patient. Ethical issues centered around communication and research discusses more than just an exchange of information, keeping things in mind of what would be culturally supportive for them and the outlook that they may have. The Tuskegee study as a profound study um, example of lack of respect for persons, beneficence, and justice, the core principles that should guide ethical conduct in research involving human subjects. The legacy of the Tuskegee syphilis study emphasizes the critical need for ethical standards in medical research. It led to the establishment of the National Commission for the Protection of Human Subjects of Biomedical and Biobehavioral Research, and the development of regulations requiring informed consent. Many things can affect the need for cultural competence, including socioeconomic factors, religious beliefs, and even family dynamics. Communicating effectively means actively listening and responding in a way that supports the patient's cultural and linguistic content. Another tool is to use simple language and avoid medical jargon to ensure that nonverbal cues like body language align with the spoken message to avoid any misinterpretation of the content. Writing skills also would hold an importance in situations where there may be language barriers. Formal correspondence, such as patient information brochures or pamphlets, should always be available at health clinics. Always consider the literacy level of your audience and change the materials if dealing with an adult versus a child. Enhanced strategies healthcare professionals can use to help in culturally diverse settings. The organization can have a staff and providers go through a cultural competency training that inform the generalized practices and specific information regarding different cultures within the community. Having patient advisory boards where materials are held to patients with additional resources and update them with relevant and understandable information. Using technology is an effective technique as it allows us to change the language of online videos or have patients translate with Google when written or spoken to. Strengthening community engagement by attending regular activities such as health fairs is also a great way to help facilitate communication within the healthcare workplace. By understanding and embracing others' cultures, the level of competency that comes along with it is significant and will continue to help healthcare professionals effectively meet the needs of the diverse populations that they care for. Thank you for your time today. A complete list of resources will be included regarding articles used to help outline the information used in this video.